active stimulant of the nervous system. Cocaine acts as a serotonin, norepinephrine, dopamine reuptake inhibitor. It is non-specific, voltage-gated sodium channel blocker which produces anesthesia at low doses and sudden cardiac arrest at high doses. The purity of the street cocaine is variable. 90% of non-medical cocaine is diluted or cut with adulterants that mimic the drug's systemic pharmacologic properties, simulate its local anesthetic effect, or resemble the physical appearance of cocaine. When cocaine is adulterated, clinicians must be attentive to the unsuspected exposures from additives. The clinical implications and its complications can be significant and overlapped. Many substances have been listed as cocaine adulterants. The list includes local anesthetics, stimulants, hashish, marijuana, talc powder, laxatives. But one prominent recently recognized example of these adulterants is levamisole. Globally, about 75% of the cocaine is cut with levamisole. To prove which, in an analysis of cocaine users in Seattle and Washington, approximately 80% of users who tested positive for cocaine also tested positive for levamisole. What is levamisole? Levamisole is an antihelminthic and immune modulator agent. In the 70s, it has been used for treatment of rheumatoid arthritis as a disease-modifying anti-rheumatic drug. In the 90s, the United States FDA approved it for use as a combined chemotherapy with 5-fluorouracil for colon cancer. Recently, outside USA, it is used for steroid-dependent nephrotic syndrome by pediatricians. Why outside USA? Because in 2000 and 2003, it became withdrawn from the United States and Canadian markets due to significant complications. Currently, it is primarily used as an antihelminthic medication in veterinary science. But in levamisole-approved countries for human, among which is Egypt, single dose of 2.5 milligram per kilogram has been recommended for antihelminthic therapy under the trade name Catrax. A dose of 50 milligram TDS for 3 days every other week for colon cancer therapy under trade name ergamazole. It is available as crystalline white powder, paste, gels, tablets, and topical and injectable solutions. When taken orally, levamisole is absorbed quickly from the GIT, extensively metabolized in the liver, and excreted mainly by the kidneys, with plasma elimination half-life 3 to 4 hours. Why cocaine is adulterated with levamisole? Levamisole exact physiologic effect when used in combination with cocaine is unclear. One theory is that it potentiates the nicotinic acetylcholinergic effects of the central nervous system, thus prolonging cocaine-induced euphoria. Levamisole might have the advantage of enhancing noradrenergic neurotransmission by inhibiting reuptake through acting on ganglionic nicotinic receptors and inhibiting monoamine oxidase and/or catechol or methyltransferase. Other studies have also found that levamisole is metabolized into aminorex, a substrate for serotonin transporters, increasing efflux when cocaine is increasing the neurotransmitter by inhibiting the reuptake. The metabolite of levamisole, aminorex, increase the efflux, thus possibly acting as an indirect serotonin agonist. Aminorex exerts strong effects on all 3 neurotransmitter transporters with distinct psychostimulant effect in a manner similar to amphetamine. Given that the half-time of levamisole and aminorex exceeds that of cocaine, as cocaine effects fades out, the levamisole aminorex effect kicks in, and this prolongs the effect that drug users anticipate from cocaine. It could also increase endogenous opioids and dopamine in the central reward pathway. Levamisole physical similarity to cocaine allows it to act as a cutting or bulking agent. It also passes the street purity test. Toxicity of levamisole adulterated cocaine, LAC. The first case reports of complications related to levamisole in cocaine users were published in 2009. Patient presents with manifestations of Susac-like syndrome, namely leukoencephalopathy, together with vasculitis and agranulocytosis. In order to understand what is Susac-like syndrome, we must explain Susac syndrome itself. Susac syndrome is a retinococulocerebral vasculopathy, is a microangiopathy characterized by encephalopathy, branch retinal artery occlusion, and hearing loss. The cause is unknown, but current thinking is that antibodies are produced against endothelial cells in the tiny arteries, leading to arteriolar occlusion and microinfarction of cerebral, retinal, and cochlear tissue. It appears in MRI as microinfarcts distributed in a linear manner in the centrum of the brain, mainly in the corpus callosum area. Back to our case, multifocal inflammatory leukoencephalopathy, MIL, is a well-described complication of levamisole monotherapy. In the few reports of cocaine-induced leukoencephalopathy, the presence of levamisole has been suspected but seldom demonstrated. In 2014, Hansen and others described a fatal leukoencephalopathy mimicking Susak syndrome in a 20-year-old man who was chronically abusing cocaine. Exposure to levamisole as adulterant to cocaine was proven by hair analysis. The clinical picture in general is usually headache, ataxia, unilateral paresthesia, visual symptoms of several days duration, rapidly deteriorated to vision loss, altered consciousness, mutism, quadriparesia, spasticity, and dysautonomic symptoms. Brain MRI findings of levamisole-associated leukoencephalopathy shows a Susak syndrome pattern with hyperintense round mass like foci seen throughout the white matter of both cerebral hemisphere, together with prominent involvement of the corpus callosum and in the sagittal section, which is very pathognomonic for Susak syndrome. While cocaine leukoencephalopathy per se shows hyperintense images without contrast enhancement as diffused bihemispheric white matter lesions consistent with confluent vacuolar degeneration. Occlusion of branch retinal arteries appears at fundoscopy, while auditory findings are lacked, hence Susak-like. The second entity is the levamisole-associated adulterated cocaine-induced vasculitis that manifests as leukocytoclastic vasculitis, cutaneous necrotizing vasculitis, and thrombotic vasculopathy without vasculitis, involving mainly the face in bilateral helix and the ear lobe. Other body areas can be involved also. Cutaneous manifestation consisting of large painful hemorrhagic poly and or necrosis, retroform purpura with or without poly may be also prominent. Unclear whether it is true or pseudovasculitis, but direct immune fluorescence findings suggest an immune complex mediated vasculitis with vascular deposits of antibody and vascular staining for fibrin. Anti-human elastase antibody is sensitive and specific for the case. Immune assay shows positive ANA and ANCA. The third entity of LAC is the association with increased incidence of autoantibody-mediated agranulocytosis. Several cases of leukopenia and agranulocytosis were reported with absolute neutrophil counts ranging from 0 to 3,000. Consumption of 50 to 200 milligram per day of levamisole causes agranulocytosis in 0.08 to 5% of the studied population. Of course, the patients become very susceptible for infectious complications. The fatality is usually from refractory sepsis and hyperthermia. Very characteristic for this case is that agranulocytosis spontaneously reversed upon discontinuation of LAC, and recurrence with re-exposure was well described. The hallmark of the treatment is stoppage of further exposure, supportive measures. Some patients have been treated successfully with immune suppressants, empiric steroids, granulocyte colony stimulating factor, wound debridement, skin grafts, and observation with drug rehabilitation. Finally, due to the impurity of the street cocaine, clinicians should always consider the presence of adulterants in the differential diagnosis of atypical manifestations of cocaine-related visit. With increasing amounts of levamisole contaminating worldwide cocaine supplies, clinicians may start to see levamisole-associated complications more frequently. Because of the small number of cases reported, the medical community still lacks a definitive agreement on appropriate lab tests to perform for diagnosis, as well as appropriate treatment strategies. Awareness of this recently characterized condition might facilitate the medical management of these patients, thereby avoiding increased morbidity, mortality, and healthcare expenses and improving resources utilization. Thank you.